For years, the ongoing mental health crisis around the nation and in central Pennsylvania has only gotten worse.
I've even heard some described as a second pandemic of sorts.
And that's no coincidence.
A lot of it has to do with the fact that there are simply more people who need mental health resources than there are people who work in the mental health field.
A lack of funding.
Right now, too few communities have crisis services available.
Compounded COVID pandemic stress.
I think without a doubt, we're not going to truly know the impact of the pandemic for years to come.
And growing challenges for young adults and children.
Some studies have shown a 100% increase in hospitalizations for adolescents experiencing eating disorders.
Have left many wondering what comes next.
People are really ready to have some additional resources put toward mental health in Pennsylvania.
We're highlighting the topics mental health experts say are the biggest issues right now. We're silencing the stigma against mental health issues in the South Central Pennsylvania region and renewing hope in the mental health crisis. Thank you so much for joining us for our mental health special, Silencing the Stigma, Renewing Hope in the Mental Health Crisis. I'm Amy Lutz. For the next half hour, we're going to be talking about the issues mental health officials say are the biggest problems within the mental health community right now and the ways we can all work together to fix the issues. Now, before we get started, we want to make sure that you take a look at the bottom of your screen. You'll see an extensive list of local mental health resources scrolling all throughout the show, and you can also find them on our website, fox43.com. Tonight, we are focusing on three major topics. First, the dire need for funding. Medical experts and mental health advocates agree funding for services in Pennsylvania has lagged behind actual need for years. In fact, the State Department of Health's budget only has 2.5% set aside for mental health and substance abuse services. Second, the declining mental health of children and teenagers. Experts are saying the pandemic and other daily challenges have accelerated an already growing problem as suicide continues to be one of the leading causes of death for people between the ages of 10 and 24. And finally, the impact on the workforce. Burnout and stress are at an all-time high, especially in education and healthcare. Masks and vaccines have caused many workers to become cynical about their jobs and the public in general. We start, though, with what Pennsylvania health officials have stressed is the biggest problem facing the mental health community, and that's the lack of funding. It's been an issue for more than a decade. In 2012, $84 million was cut from the Commonwealth's Human Services Fund, and since then, counties have been struggling to keep up with the increased need for mental health support. Lisa Schaefer, the executive director with the County Commissioners Association of Pennsylvania, says without money for crucial mental health resources, many parts of the community suffer.
Without that investment in our communities and those supports at the front end, we often see that impact on the back end. We see people who end up in crisis situations, end up in our emergency. We see people end up in our criminal justice system where they don't belong. We see other community resources having to pick up where we as a county should be able to be that safety net for our residents.
Well, Governor Tom Wolf has proposed a more than $36 million increase in county mental health funds as part of his 2022 budget, or 23 budget, which is set to be approved by July. Schaefer says while this is a great first step, that increase needs to be sustained going forward and not just a one-time increase. Throughout the next half hour, we're going to be talking through these important topics and discussing potential solutions with a mental health expert. Joining us now in studio is Dr. Michael Diller, a licensed psychologist and the director of the Employee Assistance Program at WellSpan Health. Thank you so much for being here. So let's start off with what Schaefer had just mentioned, and that's whether or not you've personally seen specific communities suffering because of this lack of funding and resources.
I would echo everything that was just shared there, because it's not just our local community, this is across the country, but our local community absolutely throughout our South Central Pennsylvania has felt this. We now are in the midst of a national mental health crisis for our children. 140,000 children across the United States lost either a primary or secondary caregiver, and now we're 2+ years into this pandemic, and it's still filled with uncertainty, and that cumulative impact has just created that much more stress. We have, now it's with the lack of funding, we have now seen limited resources to be able to turn to. We're telling people we want them to turn to get help.
Right.
So now people are, we're looking at, our hospitals are now being overwhelmed with being able to try to provide support. There are significant delays, particularly with specific populations, like children, for example. Children, I just mentioned that we have a national mental health crisis now, Amy, and kids and families and adolescents are trying to find, how do I get support for my children? What do I do? And we're trying to do better and be better in that space, but we're struggling. So the funding is absolutely essential. And being able to help be able to expand and set a long-term plan in place to address the needs of our mental health and our own overall well-being right now for our current group and our people right now, but it's also for long after now. It's trying to set those things in place. We have, kids and even with more complicated, situations like with autism, spectrum disorder, developmental disorder, even harder to find. Psychiatry services for medication, even more of a delayed wait. So the longer we delay, the harder it is to get that support, and we want those people and families to be able to get the support that they need. And being able to create, so it's not just about the hospital systems being able to help. It's everyone. It's our community, and being able to collaborate with, being able to fund our community mental health supports and resources and offerings in the home-based services, community offerings like Mental Health America, NAMI, the National Alliance for Mental Illness, and other organizations that are driven and passionate about doing this, but they need help in terms of funding to be able to expand these services.
Well, so let's talk about that. If that proposed $36 million increase in the budget for county mental health funds, if it's approved, what changes, if any, do you think we could actually see?
Well, I think with more funding, we're going to be able to then to create more resources and being able to provide behavioral health and mental health supports within our, sometimes even being able to offer programs within our schools. We do have some now that are there, but we need more. We need more of them. We need more help. And it's not, sometimes I've seen things like curriculums that we could bring in to help, teach and build resilience and grow, and support good mental health of our young children. That's an area of key focus, but we have to be able to do that and support that. Sometimes it's, if we develop a curriculum, we may ask our teachers, here's a curriculum that you can now also incorporate with everything else that you're doing in terms of the educational focus. We can't do that to the teachers because then that overtaxes them and stretches them too thin. We need to be able to create more opportunities with this funding for resources to be able to be developed and offered within our schools, within our community mental health resources and places that people can turn to, like NAMI and like Mental Health America. I'm going to those two because there are two national organizations with local chapters throughout the country, but there are other great organizations too. Community collaboration is going to be key in being able to take a look at where is going to be the best use of this funding. And when we do this, we also then alleviate some of the pressure on the hospital systems, for example, because there are times that people are coming in, if they can't find something to help out, they'll come to an emergency department. And then the emergency department is then struggling to try to find, how do we get these people connected to the supports that they need? And sometimes we have complicated, layered situations and stories with people with mental health, long-term needs, and being able to create and use the funding, the additional funding, to create resources that could allow hospitals then to be able to coordinate and collaborate with our community organizations to give them the support that they need. Otherwise, they end up staying in the hospital and they're not getting the best care that they need. It's all about creating more opportunities and avenues and resources collaboratively. So we're all in this, we hear this all the time. We're all in this together, right?
We are, right. And we have to work together to be able to go forward.
Right. It's not about one health system. It's not about just one organization in the community. It's about how can we come together and collaborate and identify where are the gaps and the needs. And we do see them. The gaps right now, are in different places, like our own healthcare industry, our education setting, which we know that two hardest hit industries, that have come through this pandemic and have really struggled with just being able to make sure that they take care of their own well-being.
Well, listen, we're going to have you stick around.
All right.
All right.
Wonderful.
Yeah, because we have a lot more to talk about throughout the show to get your take on the mental health crisis in our country, and the one that has been there for quite some time now. So with the mental health crisis, though, only getting worse, right? National efforts have been made, though, to change the 10-digit suicide prevention lifeline to the number 988. And this is a really big deal. It would make it easier for people to use.
Ultimately, we need to make sure that people are getting good quality services and that we want them talking to trained individuals that know how to respond to a caller in crisis.
Each state is responsible for their own transition to the 988 number. Fox 43 finds out if Pennsylvania is ready for the launch of the new number this July, and you can find that story online right now. It's on our website, fox43.com. Still to come, a look at mental health issues in kids and young adults. We'll tell you more about an initiative making its way into York County schools to help. That's when our Silence the Stigma special returns after this. Welcome back. 30 million Americans suffer from eating disorders. They come in many forms, but they all share one thing in common: mental health. A national survey points to social media as a main cause for the huge spike in cases. From filters to intense editing, 88% of college students polled say social media is making their body image worse. 19-year-old Mia Kennedy is an eating disorder survivor, and she says most people don't even realize what's happening when they log on.
When you're constantly scrolling, because it's just like this quick, like moving on to the next thing, your brain absorbs so much where sometimes you're not even thinking about it and you just assume like this is the standard.
It's especially concerning for younger kids who are now accessing social media so much earlier. Experts say that educating parents and children is the key. To help, State Representative Jason Ordite has introduced a bill that would require schools to give parents of children in grades 6 through 12 educational information about eating disorders.
Mental health, I feel like it's never been needed more, and we've never really put the resources into it that we should have. And I feel like we're at that crossroads now where we have to address this.
The bill now sits in the Education Committee in the State House, and Representative Ordite says he hopes that it will be signed into law by June. With the mental health of children becoming a major public health concern, the American Academy of Pediatrics is now calling it a national emergency. Amidst the crisis, students in York County schools say a new mental health initiative there is giving them a new outlook on their futures.
We weren't here for 2 years. We were on and off and gone for days at a time. And I don't understand all the things I'm supposed to because I wasn't here. I was in quarantine.
Spring Grove High School freshman Jaden is talking about anxiety, something health experts say children and young adults face more of every day. And it's directly tied to the pandemic.
So I was in 8th grade, I think, when COVID hit, and they really didn't give us any knowledge. They were like, clean your lockers out, bye.
Many young adults have missed major milestones the past 2 years of their lives because of COVID-19. And a lot of these Spring Grove students are still coping with the fallout of everything that's happened.
It was bad. It wasn't fun. You didn't want to do any learning, and it just didn't feel like school anymore. And coming back to school, that was even harder.
That's where the PAWS program comes in.
We're here to help you help yourself, not take responsibility.
It's what these students say is really helping them.
We are here to discuss steps with people, not take steps for them.
Peers Advocating for Your Success Every Day, a program by NAMI of York and Adams County, has made its way into York County schools to help students cope with the increasing physical and emotional stressors.
When I started coming here, I feel like people started I noticed I wasn't alone because I always felt like no one really cared. And starting to come here, I feel like since I have friends in here and they didn't really know about that part of my life, I really never tell anyone anything. So them knowing it and being okay with it and not saying anything bad about it makes you feel comfortable.
Currently, the group meets multiple times a week during school hours in 3 different York County districts.
Everyone, when they come into this room, whether they understand you or not, whether they have different political beliefs than you, everybody has their own thing. But in this room, we all acknowledge that we're way different. This is a huge safe space.
to allow students the chance to talk openly and confidentially.
Even if you don't say anything in these meetings, you still realize that there are people going through the same stuff or similar stuff as you. And even if they're not, they can be here to try and help you.
Well, NAMI officials say by this fall, the program will be in 7 different school districts in York County. So we want to bring in Dr. Diller now again, and there's obviously, we just saw it there, work being done. The people are trying. How do you think initiatives like that one, like the PAWS program, really help the well-being of our children?
First of all, I got to say that's outstanding. So when we had talked, you had asked me the question, and we talked about the funding and the need for more funding.
Yeah.
That's what we're talking about, being able to do something like that. And here's the thing about that. That's not even to the level of counseling. This is more now this is more of just if we do more and more of this, having these conversations, breaking down the stigma, having these conversations, allowing people to come in and be vulnerable, be real.
And realize they're not alone, right?
There you go. And that's huge, because sometimes people, when they start to struggle with their own emotions, they feel like they're on an island.
Oh, absolutely.
And the Gen Z group, what we just saw there, has been really the hardest, when you look at the age groups, the hardest hit. And you mentioned something at the top where suicide is one of the leading causes of this age group of 10 to 24-year-olds. In 2020, we actually saw suicide rates drop for every age group except for this one, 10 to 34-year-olds. So we have much more work to do in that space. Things like this, we're bringing it to the people. So the funding, if we create more opportunities to bring it to the people, then we're actually we're helping our younger generation connect it to our families, and then it has a ripple effect. And they absolutely get a chance to say, you know what? I can go here, I can just be myself, I can be seen and heard, and I can be lifted up. And at the same time, I can also be there for someone else.
And can you imagine every school having that? I mean,
I would love to see that. I would,
I think it could make the biggest impact. It really could.
I'm with you 100%, because you know, Amy, we live in this world right now that is so flooded with instant. I need information. Boom, I'm right on getting it, and it's so fast. We live in this whirlwind. The pandemic only exacerbated that, made that worse in terms of just that overwhelming feeling. This gives us the name. I love it. Pause. It's not stop the world. It's just take a breather, slow down, and we all have the ability to be able to do that. And
we just need to.
We just need to. And sometimes we need that encouragement from others, or others to create the space and invite people in to do that. And when we do that, we teach things like self-compassion, how important it is to take care of yourself, what it's like to say, you know what, let's just be human together for a little bit. And we can do that at this age, but we can do that at our age or whatever age it might be. And so we can learn a lot from our kids. And this to me is really a lesson, not just for our children and our kids. So every school district, yes, but I would love to see it in other organizations in terms of some form and fashion to be able, hey, we're gonna build in a little slowdown time, or we're gonna encourage you to take a little bit of a time out, or you need to tap out when you need to. Not tap out because it's weakness, but tap out to actually empower you to be even stronger. I would love to see that. You're not alone. Love the message.
I know.
We could go on for a while.
NAMI does incredible things, and that program especially is just fantastic. Now, I know this is it's a bit of a loaded question here, but you know, what do you think we as parents, friends, counselors, teachers, what can we personally do to help younger adults combat these rising issues? What can we do other than have these conversations or try to find the resources for them?
Well, I think those things are where you would absolutely want to start. Sometimes, as I mentioned before, and we just talked about, you came back and said, you're not alone. That's the message. You know, and it's messages in our schools and our communities, but it's also messages within our families. Sometimes when we start to feel depression and sad and just struggling, we withdraw. So, and that individual may not even realize what's going on, and it's really important for others around them to notice, okay, this is not quite, you know, Mike's not being himself. He's a little bit different. It's not just today, it's been the last few days. That is an invitation or an opportunity for parents and even extended family. It could be grandparents, or it could be whoever may have a really good relationship with that person, but we can foster that and just let them know, just be present, check in with them. And sometimes kids, depending on where they may not be interested in sharing at the moment. But I gotta tell you, it has lasting, powerful meaning if someone knows you have my back. I'm here for you. Even if it's not now, we don't have to talk. We're not going to have, a dad moment right now, but I'm here. and I want you to know that. So if you need something anytime, anywhere, I'm going to be here for you. And then it's those other things, making sure that if parents have questions, to reach out, to ask a trusted professional. And that could be in the mental health field. It could be even with a family, you know, a physician or a doc or someone else they may trust. This is what's going on, so that the parents also get support. They're not alone in being able to support their kids.
It can feel, I'm sure, just as lonely for the parent as the child.
Yeah.
All right, Dr. Diller.
No, it's
Mr.
fine.
Diller.
It's fine.
We are going to take a quick break, so stay right there. But
Perfect.
We are going to be right back. And coming up, the COVID pandemic has drastically impacted our everyday lives, especially at work. And after the break, we'll hear from professionals in some of the hardest hit industries about the impact the last 2 years have had on their mental health. Welcome back. Recent data shows that stresses over money, inflation, COVID-19, and geopolitical tensions are at an all-time high. According to the American Psychological Association, virtually every aspect of life has changed since COVID-19 became a global pandemic more than 2 years ago. 63% of people surveyed said they feel like their lives have been changed forever by the coronavirus, including negative impacts to their mental and physical health. Now, what the study calls sustained survival mode has caused many people to experience mental health issues and revert to unhealthy behaviors. At least 2 in 5 adults say they've relied on unhealthy habits to get them through the last 2 years. And that includes increased drinking and bad eating habits, which have led to unwanted weight gain. And at a time of already heightened anxiety, imagine having a stressful job on top of it. The American Psychological Association found that positions in education and healthcare are among the most burned out professions in America. We talked to individuals in each of those industries to see how the pandemic has impacted them firsthand. Grace and gratitude.
I mean, we don't have a ton of grace in our society right now, right?
That's what veteran leaders of the healthcare and education industries in South Central Pennsylvania say everyone needs a little more of following 2 years of the COVID-19 pandemic.
It's really put us to the test because patients have really been stressed not only physically with the pandemic, but emotionally. And that's provided a lot of challenges for us.
An American Psychological Association report on worker trends at the beginning of the year shows the education and healthcare industries are more vulnerable to high rates of worker burnout. The report also shows that the problems were persistent even before the pandemic. And both Dr. Ridgely Salter with WellSpan and Dr. Laura Sharp with IU12 agree.
Some of that was due to societal issues such as an increase in school shootings and school violence, some social media kind of aspects of things where aspects of the school process were being politicized.
And she says they've only gotten more complicated with the coronavirus.
The misinformation that a lot of patients unfortunately have received, and it's been tough to combat that with what we know is evidence-based medicine, and so that's provided a conflict amongst a patient and care team that we hadn't experienced a whole lot in the past.
Which has led to one big issue a lot of people are familiar with in 2022.
We've suffered from the Great Resignation just like other industries.
Teachers, bus drivers, nurses, all these people that support the schools are part of that Great Resignation that we're seeing in our country and many other fields as well.
So while funding and staffing remain the biggest priorities, they say there are 2 things that can be focused on right now.
I think we need to give kids a little bit of grace. We need to give the teachers a little bit of grace. We certainly need to give parents a little bit of grace.
And
it's easy for us to talk about what's stressful, but we really should pause and take a moment about what we're grateful for.
All right, so Dr. Diller, for you, I'm guessing that this is may particularly be hitting close to home for you.
Yeah.
But why do you think healthcare and education specifically have been so directly impacted? I mean, it's obvious, but I mean, just tell us your experience, I guess.
Yeah, and I think I so appreciate both Dr. Sharp and Dr.
Yeah.
Salter. I know them both. I have tremendous respect for both of them, and they're speaking such truth there.
Yeah.
And it does really kind of stir and resonate with me, just so particularly over the last 2 years, what we've seen. But they did mention something that, and we've talked about this already. This was here before the pandemic, and the pandemic has only made this worse. These 2 professions, if you ask people, a lot of times why would you enter this kind of giving field? And it's a calling for most. So there's a great passion, and so there's this this drive to say, you know what, I'm going to do everything I can, whether that's in my role as an educator or my role in whatever role I may play in the educational system or in healthcare as well. So that drive just keeps going no matter what else may be happening. And what else may be happening, as we know, has just been monumental in terms of being able to try to find a way to balance that. And so you have that, it's that cumulative effect that was already stressful to begin with, that now with these two particular walks of life are particularly challenging because people are driven to do the right thing. They want to do the right thing. They just want to take care of the people in the ways that they do, whether that's in the healthcare field or the educational field. And they've struggled mightily and reconciled along the way. They mentioned the great resignation, the great reflection.
Yeah.
So a lot of people, I've been one of them, have asked themselves this one question: what really matters to me?
Yeah.
What really do I find value in? And when they've asked that question, sometimes they've evaluated to the point where I'm at professionally right now, I can't continue to sustain in this way. And they have left. Millions over millions of people have left. That's impacted, as you heard Dr. Sharp say, and Dr. Salter, both the healthcare industry and the educational field as well.
So what can actually be done, though, right now to directly address the growing burnout problems? Is there anything that could even help at this point?
Yeah, just
it feels so helpless. I'll admit. I mean, it really does.
And I think, sometimes we have to start there and acknowledge where we are and acknowledge that feeling that, you know what, it does feel helpless right now. And we also, sometimes we think about what has happened. This is drawn out now over 2 years. People are I'm just ready to move on with my life. I want the way life used to be. And what we're seeing is that life won't ever return to the way it used to be.
Right.
So what do we do how do we find the best way forward? And what do we do now? And so right now it's about just trying to find ways to slow down, acknowledge that it may feel helpless right now, affirm that, but not allow that to keep us stuck in that place. So what can we do? Focusing on what we may have control over as an individual and being able to start there. So we get to play an active role in being able to find our way through some tough storms, because as we know, storms will not last forever. They will come to a close, and we need to find ways to be able to get to the other side. And some of those ways we can focus on the individual self-care and being able to stop and be able to hit pause like we saw from the NAMI program and being
for
able
the adults.
Right.
Yeah.
But we can do that as adults as well, and making sure we don't lose sight of that. But it won't only be, sometimes resilience is used and people are like, well, resilience, so you say it's all about me, I have to be more resilient. It's not about resiliencing our way out of this. That's important, but we also, even our own organizations, have to take a hard look at how do we support our fellow colleagues that we're asking to do the work. So Christina Masloch, for example, is an expert researcher out of University of California, Berkeley, on burnout. She is one of the premier researchers on this, and she talks about one simple thing. If we're going to ask people to do more, put on their plate, we need to also, as an organization, find something that we need to take off. Something as simple as that, so we can help people with this idea of grace. It's almost like a gift of grace when we start to do those things. And how do we take a look at our kind of our benefits, in terms of what we offer people, in terms of helping families and kids with our colleagues with childcare needs, maybe after school tutoring types of things, the ability to maybe find other growth opportunities within an organization, recognizing people for doing amazing and great work. Those kinds of things matter as well. So it's a combination of organizational at that level, community level, and then also the individual. So we need it all.
And it sounds like the most important word was grace.
Yeah.
Grace.
And so
you gotta start there.
Absolutely. And it is. It's grace and it's self-compassion, and we need to start there. I get so excited about this. But Sebene Selassie wrote the book You Belong, and she talked about the pace of the world that we live in, no matter what industry, whether it's education or healthcare, no matter what walk of life you may be in. And she said, we live in this whirlwind, and she said one of the things when we get caught up in this whirlwind that we need to remind ourselves is we need to be able to slow down. She's very direct in how she states that in her book, slowing down, stepping out of the whirlwind and return to the self, where we can actually come back, have a little grace for ourselves and start there. That's self-compassion. And when we do that, and it becomes almost contagious in a positive way, because if I do that, and I encourage you to do that, Amy, then if you can encourage your circles of people, it does, in the most positive way. And that, we all have the power and the ability to do that. We can offer hope When sometimes the flames of love and the flames of faith may be tested, hope can reignite those. And we can turn those into something that maybe we didn't see before that was possible. We can do that. I can do that. You can do that. And sometimes it's the smallest gesture of kindness, care, empathy, and compassion that has a monumental positive impact on the person who receives it.
Yeah.
And one last thing.
Okay.
When I do that or you do that,
yeah,
it actually benefits the giver just as much as it benefits in different ways as the receiver. Grace, hope, I love this.
I know, I love it too. I would talk about this all day long, but we have to go to the break. But thank you so much.
Thank you.
And still to come on this Fox News special report. A recent study put the United States at #1 for the most expensive country for mental health care. After the break, we'll hear from a professional about what needs to be done to improve the problem. Well, a recent study put the United States at #1 for the most expensive country for mental health care. So what can be done to improve financial access for patients? Fox 43's Madeline Cudahy looked into the issue to find out.
Spending on mental health care treatments and services reached $225 billion in 2019, and 71 of that was just on treatment for depressive disorders.
Mental health is medical health. There's really no difference.
Alyssa Ott with Keystone Therapy and Trauma says access to care can be expensive, especially when the numbers of people in need are rising.
So you're looking at a system of they're approving more individuals for medical assistance in particular, but then there's not the providers that are needed.
Across the Commonwealth, yearly, the average out-of-pocket cost for an adult with mental illness can tally more than $8,400. And the Kaiser Family Foundation survey found that 27% of people who say they need care for mental health aren't receiving it because of the high cost.
Sometimes what you're looking at when you're talking about the people that can't afford it is essentially an issue of payers not paying providers enough.
Ott says without a better structure for people to find and access the care they need, those costs will only increase.
So then what that would look like is essentially a provider that doesn't work with your specialty. So the problem will get worse. Then what's going to happen? Then they're going to need a higher level of care because they're not getting the specialized care at the base level to really work through that specific problem.
And then the costs add up.
Costs add up over time completely.
A system in need of reshaping to provide more cost-effective care for Pennsylvanians. Madeline Cudahy, Fox 43 News.
All right, so Dr. Diller, I'm not going to lie, it is extremely hard to hear that people aren't getting the care they need and because of money. I mean, that is something that's really difficult to comprehend. So what is your best advice for individuals who are sitting here watching this thinking, I do need help, I need the care, but I can't because of my financial situation? What do they do?
Yeah. So I would say, I mean, that's heartbreaking, first of all, to hear that. It's interesting. It kind of brings us full circle from where we started in terms of talking about the lack of funding, the need for funding, and that's exactly, if we go full circle, where we are here right now in this conversation. So I would say this, if someone is absolutely in any kind of urgent need of some type of mental health or behavioral health support, mental health need, something in there, they're struggling emotionally, they have a high level of emotional distress, and they feel they can't, because of finances, be able to reach out to, say, set up for a counseling appointment. Sure. We do have those resources, and you mentioned one earlier, the National Suicide Prevention Lifeline, which is now, it's a 1-800 number, but in July, you mentioned it, it will go to 988. That's one option. So that's telephonically 365 days a year, 24/7. We also have the National Crisis Text Line, 741-741, and you can text talk or help or connect, and anyone can get there. That's 24/7, 365 days a year. Okay. Professionals will be there to support people on the other side of that. Sometimes people prefer just kind of texting as opposed to telephonically being able to talk to someone. Sure. So those are two immediate things that could be there with someone who may be having a higher level of distress. I would also, when I think back on our conversation today, organizations like NAMI, organizations like Mental Health America, MHA, they have different resources and sometimes can also help people who may be struggling financially to get support. So it may not necessarily even be the counseling. There could be other groups of support that could be offered, other resources that could be offered. And that's where that funding also creates opportunities for more programs that we can bring to the people, that we can offer to the people to help. So we don't get into a situation where we just saw that, where people are struggling, they're not getting the help that they need. And what we do know is healthcare costs will rise astronomically because other things start to get, in situations where they're not being able to care for there. I mean, other medical conditions, and things get worse, and they're not able to take care of one piece, and it's all connected.
Yeah.
Our physical and mental health all connected, and so people are struggling in that space as well. But we can do some things about that. So that would be my suggestions.
Those are really good
Yeah,
tips,
yep.
really good numbers to know, and I'm sure everyone has been keeping note of all of those. Of course, we are going to have all that on our website too. But
Wonderful.
listen, we want to thank you so much for sticking around throughout our show.
Thank you.
We appreciate your expertise and your advice on what has been a devastating situation, and hopefully we can see some change in the future.
Yeah, I'm with you, and I, one fellow leader one time mentioned that this pandemic has been unforgiving, and I would agree with that 100% in some ways, and it's uniquely in our own journeys, my journey, your journey, but collectively as a community, society, families also. But there is hope, though, and I so appreciate you being able to kind of shine the light on mental health and well-being, because mental health is health, and we need to be able to make sure that we create opportunities to do better and be better, and we have a chance to do that now. It's an invitation right now to do better and be better.
I love it. Thank you so much. Thank you. And thank all of you at home for joining us for this 30-minute special, Silence the Stigma, Renewing Hope in the Mental Health Crisis. Remember, if you or someone you love is experiencing a mental health crisis, the number for the National Suicide Prevention Lifeline is 1-800-273-8255 until it transitions this July to just 988. We'll have our full discussions with Dr. Diller and all of the resources we have listed on your screen, also on our website, fox43.com. This concludes our special program. Thanks so much for joining us. Good night.